Welcome to Breathe California TV. Each week we present a show focused principally on preventing damage to your lungs, which is the purpose of Breathe California. Most of medicine is all about treating diseases, but we're trying to prevent it. And we're going to be talking with Supervisor Susan Ellenberg, whose County Board of Supervisors has been doing a great job at preventing a variety of health problems for us. So stay tuned, we'll be back in 30 seconds.
What it feels like to have an asthma attack is, well, you can't breathe and you can't tell anybody that you're having an asthma attack because you can hardly talk. You can maybe say one or two words, but you can't say much else. Breathe California has helped me come in contact with more asthmatics and more people who have the same case as I do. It's important to me because I don't feel like I'm alone in the fight against asthma.
Welcome back. I'm Terry Trumbull. I'm a volunteer with Breathe California. If you have any question about lung diseases or you need some assistance other than from a doctor, give them a call, 998-5865 in San Jose. Susan, welcome. Thank you for joining us.
I'm delighted to be here, Terry. Thanks for the invitation, and thank you to the work of Breathe California that they do to keep our community healthy and stay informed about ways in which we can all live sustainably.
So I'm going to start out with a question or two that wasn't ones that we originally thought about, but you were a school board member when you were elected. And my experience with school boards and counties is quite different. School board, a lot of parents involved, very intense, and the county, if anything, suffers from complete lack of awareness of what in the world you're doing. So talk about both what the differences were and what the county does.
Sure, absolutely. First of all, one of the biggest differences is that serving as a school board member is truly a very part-time job. We don't have our own staff. We're not so directly engaged in operations or regular activities, but we do participate in strategic planning and, of course, oversight of the budget and supervising the district superintendent, much in the way we do the same with the county executive right now. At the level of county government, we are so much more involved across a broad spectrum of programs and departments, and I'll say a little bit about what the county does, but I first want to just share a quick. The thread for me between school board and county was that it was really what I saw as a school board member, where so many students struggled, didn't keep up with their peers, faced numerous challenges. So often the issues weren't academic, they were socioeconomic. And if kids were unstably housed, had insufficient access to nutrition, didn't have access to good quality health care, were victims of or witnesses to violence, these were all things that impacted their learning, but things that school districts generally don't offer. And what I saw was that all of those tools were at the county government level. So I chose to run for the county seat really with the same goal of supporting youth, but doing it with a much bigger toolbox. And I certainly heard numerous questions when I was running for the board seat, knocking on doors. I'm running for supervisor. Who are you supervising? What do you do? So it was a great opportunity for civics education, and I like to differentiate the responsibilities of city and county government kind of along the lines of infrastructure and human services. Cities generally focus on infrastructure, streets, buildings, sidewalks, zoning, municipal services, and economic development, whereas counties are primarily responsible for public health, public safety, and public social welfare. So that includes things like housing stability and behavioral and mental health services, food security, access to health care, employment services, foster care, senior care, And of course, the criminal legal system. The public health system is housed in county government. And, even though our primary role is providing care and services, we also operate 20 county parks. We conduct inspections of restaurants and scale inspections at gas stations and grocery stores, and just a whole slew of other services that people generally don't spend a lot of time thinking about.
Well, I think all of us know that schools are predominantly state funded and they're not being funded to provide social services. You feel like the county is getting adequate funding to provide those kind of social service needs?
Well, this year we have a budget from the state, the likes of which we have never seen before. There are significant investments in early childhood, in housing, in food security, in so many of the pieces that really shape the stability of children and families. And you're of course correct, Terry, that school board funding, school district funding is divided at the state level. It comes from local property taxes. The majority of county funding comes from state and federal sources as well. It's actually a small portion of our budget that comes directly from local taxes and, in fact, which the board has any discretion over. Counties are an agency of the state government, and a lot of what we do is the administration and pass through of dollars for those social services.
So I've joked with your staff a number of times about the number of committees you serve on, 30 or 40.
Something like that.
If you want to know how broad your job is, that's a good description. Talk about the variety of those. Are you on the Valley Transportation Board?
I am not. One of the few areas in which I really am not directly engaged is the VTA and MTC and the other transit bodies. Each of the Board of Supervisors sits on two board policy committees. We chair one and sit as the vice chair of the other. And since I joined the board, I've been the chair of the Public Safety and Justice Committee. I'm currently the vice chair for the Children, Family, and Seniors Committee. I sit, as you know, on the LAFCO board, on the Silicon Valley Clean Energy Board, the Reentry Network, and a host of others. But there are varying degrees of involvement and activism in each of those boards. And I would say that my primary time in terms of hours and policy investment is on the two board committees and Silicon Valley Clean Energy. And the First Five Commission. Goodness, I'm the chair of the First Five Commission.
So that's a pretty significant range of activities. Mm-hmm. How'd you get the legal committee with the criminal justice system and the jails? Well, I know your husband's a lawyer, but are you one?
I am a lawyer as well. My husband and I, in fact, met in law school. But I don't think that had anything to do with the appointment. The board chair has the prerogative of assigning committees, and as the newest supervisor on the board, you are generally assigned the two open spaces, whatever is left. So I was assigned to Public Safety and Justice and as vice chair of the Health and Hospital Committee when I first joined the board. And what I would like to do, and this is a little bit different, most of my peers and predecessors tend to get on their committees and stay there and really develop long-term expertise. And of course, there's tremendous value to that. And I would like to remain as the chair of Public Safety and Justice. But what I would also like to do is over the course, God willing, of 3 terms here, I would like to sit for a time on all 4 of the other committees, because I think that is really one of the best ways to learn about the full breadth of county programs and services and really have that opportunity to dive in at a very serious level to all of the committees. So I spent 2 years on Health and Hospital. I'm now doing the Children, Family, and Seniors, and over time would like to work on all of the other committees as well.
So at least a little bit, let's talk about the medical side of things. Many people
Sure.
may not realize Valley Valley Medical Center is not just another private hospital, but tell us about what its role is in the community, which I think is quite important.
Oh, absolutely. Valley Medical Center, which initially was really Valley Medical Hospital on Bascom Avenue in my district. In fact, this is a huge county hospital that serves anybody who walks in the door. There are very few people left without health insurance these days, thanks to the Affordable Care Act and some other local products for insurance. But for a long time, the county was the hub for people who were uninsured, but we are also a training center. We have residency program partnerships with Stanford Medical School. We have the highest level of trauma center designation. We are regional and perhaps state experts in spinal care and traumatic brain injury. So the level of care that's available at Valley Medical Hospital really is absolutely on par with any top-rated private hospital. The facility also happens to be a gorgeous one, and for folks that have preconceptions about what county hospitals look like, I would encourage people to visit and take tours of VMC, because there really is an understanding that healthcare, it involves physical environment and lots of windows and access to fresh air and beautiful art and all of the things that create a healthy environment. So that and about 14 health clinics were the center of the county's public health system until March of, I think, 2019, when we purchased O'Connor Hospital and St. Louis Hospital, which were in bankruptcy under the ownership of Verity. And those two hospitals were in grave danger of closing. And of course, this was before we had any inkling that a pandemic was on our heels. And the county was able to purchase those two hospitals out of bankruptcy. We were able to save thousands of jobs that way. We were able to expand the services that we were able to offer. And, you know, with hindsight, the thought that had the county not bought them, that those two hospitals would have been closed, the dramatic impact that that would have had on our ability to provide care during the pandemic just absolutely can't be overestimated.
So I think that's really a critical point. The timing was great when we needed maximum healthcare availability. And my side editorial comment, I just think state of California is great in requiring every county to have a hospital that takes care of everybody. To me,
absolutely.
That's a real significant point than being left high and dry because you weren't rich enough.
And that is the core of county services. We are the safety net. I explained also to folks at the doors, if they were living, you know, relatively stably financed lives, I'm not talking about wealthy, but, you know, having a stable place to live, knowing you could get food every day, you may not ever be aware of county services. But for the folks that need them, we are absolutely critical, and we are life-saving. We knew that before the pandemic, and I think that we have made that case very, very strongly during and coming out of the pandemic.
So we're going to take a 30-second break now. We're about halfway through.
Okay.
When we come back, you can explain to our audience how the county was able to achieve the lowest infection rates for coronavirus of any county in the Bay Area, maybe in the state for all we know. So we'll be back in 30 seconds.
It's given me a chance to go out and be with people who has the same problem. And it helps you to manage your life better too, because you hear different things from each person. And it's just been really helpful in many ways.
So welcome back. This is Breathe California TV. Each week, Breathe California presents a show to discuss principally health issues, and hardly anybody better than the chair of the county's health committee than Supervisor Susan Ellenberg. So I promised everybody you're going to give us an explanation on how you got the infection rate so low from COVID.
Sure. Well, let me start, Terry, by explaining the role of the public health officer and of the Board of Supervisors, because absolutely the heavy lifting was done by our public health officer. Dr. Sarah Cody is appointed by the state of California. Every county has a state-appointed public health officer, and that is a separate role from county government. She, in that role, is not accountable to the Board of Supervisors in that we have no role in directing public health orders. Dr. Cody is also our director of public health, and in that aspect, she does work for a county department. And throughout the pandemic, as the board has asked for dashboards and information and data, we've been able to get that from her. But if you'll remember back so many months ago, Dr. Cody, along with 5 or 6 Bay Area partners, were the very first to issue shelter-in-place orders in the country. And that early and decisive and regional level action was absolutely significant in containing our rate of infection. And I think some of the other things that helped were that we were, first of all, fortunate enough to have sufficient hospital capacity, not only within the Valley Medical Center, 3 hospitals, but with all of our local hospitals, all of whom really worked together to be sure that we could meet those early needs. If you recall, there was insufficient personal protective equipment in those days. So a lot of us across departments, as well as the Board of Supervisors, were reaching out in every possible direction to secure PPE. We were, amongst the first to be able to broadly do testing. We ramped up so quickly from several hundred to many thousands of tests a week early on. Something else that our county did, which I think was less common, was that we were very proactive in offering isolation supports, and this was one of the initiatives that I led on, because we knew that for essential workers who had to go to work, if they became infected or exposed and weren't in a position financially to be able to stay home in quarantine, then they would either put others at risk or they would lose their jobs. So with partners, again, we set up programs where we could provide stopgap income if people were at risk of not being paid while they were quarantining. We were able to offer hotels for folks that lived in, perhaps multifamily or multi-generational households and weren't able to easily isolate. We helped with grocery deliveries and prescription pickups. Basically, this entire county worked so hard to make it as easy and convenient as possible for people initially to follow the shelter-in-place orders, to get tested, and then to get vaccinated. And we've done a lot of outreach and education. We've spent considerable time making sure that we were delivering information with cultural and linguistic competency, so that everyone that needed to hear us did hear and had a sense of why this was important and why it was important to literally every person in the county. So I am immensely proud of the work of our public health officer, of our public health department, of our county council, executive team. We had tens of thousands of county employees that were deployed as disaster service workers, many on site throughout the entire pandemic. We also had folks working at home through the pandemic and making sure that we didn't have lapses in essential services. And You know, it's an incredible thing, Terry, to behold and to start already to be able to look back on and see what this county was able to accomplish. And we did lose lives here, and any loss of life is tragic. But I know we also saved so many more, and I am very proud of Santa Clara County and the work that we've done.
Well, I think that's why I wanted to make sure you got the praise here. I think it's particularly meaningful that you start out talking about early announcement and action, because in government generally, the first ones out are badly abused. Everybody kind of needs to learn from the experience elsewhere, and the Bay Area public health officers seemed to me that they were superb in jumping on this issue as quickly as was reasonable.
I think so. And certainly we heard about public health officers across the state and across the country who were not met with welcome arms. And it's hard to be in a position to give people literally orders to do things that make them very uncomfortable, that took us so far out of the familiar environments that any of us have lived in. And it really is a testament to Dr. Cody and others that they have been able to withstand those challenges and continue to do such good and high level work.
So you may be aware, I've seen Mercury News articles that Santa Clara County has got the lowest rate in the 9 Bay Area counties.
We have the highest rate of vaccinations of any metropolitan area in the entire country.
Well, that is just great. You know, you realize with very conspicuous examples, there are still people like star basketball players who are avoiding things. And I worry about it a lot. I have a brother who retired 1.5 years ago in Idaho, and they've been announcing they don't even have a bed for anybody with coronavirus, just because they're so packed as it is. But whatever expansion and programs you guys threw into place to respond to the crisis, they were never smart enough to do it there.
We did, and we really did everything. We took on housing stability with the eviction moratorium. We knew how disastrous it would be for people who had already lost jobs, either temporarily or permanently, to be at risk of eviction for not having income to pay rent. I paid some specific particular attention to our small business community, getting out both loans and grants to small locally owned businesses. We reduced fees, inspection fees for this year. In fact, eliminated a number of restaurant and weights and measure fees, just doing everything we could to be able to mitigate the impacts of the public health orders. And that's where the Board of Supervisors focused. We didn't make or amend or direct the public health orders, but I saw it as our job to mitigate the collateral consequences, which in many cases were real struggles to businesses and to families and individuals.
So I'm going to switch to climate change for the rest of the show, and
Let's do
we're going
it.
to start out with giving you and the board a compliment. Breathe California had its annual fundraising walk October 2nd in Hellier Park, which is a county park. And I was able to announce at the start of the event, mostly because I was the MC of the show, that our city forest, with a grant from the county, was going to be planting 210 trees. And it may not hit some of our audience members, but trees are great ways to sequester carbon dioxide. as well as been big front page stories in the New York Times and National Geographic showing the impacts of having trees. The better well-to-do areas, the ones that people are more comfortable living in, are highly treed. And then there are areas that the New York Times article had 5 different areas of the city, and there was a close economic connection and happiness connection depending on the number of trees.
And health connection, Terry, because the trees are so beneficial in so many ways. They're creating shade structures, which keeps the ground level a little bit cooler and a little bit healthier. As you mentioned, of course, they're sequestering carbon and keeping the air filtered and healthier for people to breathe. There's certainly that psychological sense of well-being. And we're not stopping at a couple hundred trees. We are providing funding and working on this ongoing. We need to plant 1,000 or more trees every year, and we absolutely need to focus in what are literal environmental deserts in places like East San Jose that have far fewer trees per capita and hotter ground temperatures and less healthy environments, particularly for kids. You know that supporting children and families is always my North Star and the work that I focus on. But what was actually a little bit surprising to me in preparing for this interview and knowing your interest in environmental issues was how many initiatives I have led and supported in the area of environmental sustainability since I joined the board. So I guess it's my stealth policy passion area.
Well, one of the things I just want to emphasize for our audience is that while 95% of us in California breathe unhealthy air, climate change fixes sustainability are just other names for air pollution control, because air pollution is dominated by burning fossil fuels. So the work you're doing in that area is just vital. Worst air pollution in the Bay Area happens to be in East San Jose all the way south through Morgan Hill and Gilroy. Well, I'm getting a wrap signal now. You got some last 30 seconds of joy for us?
I'll make my last 30 seconds of joy really focused on environmental sustainability. There are so many things that individuals can do. We can to lower our carbon footprint. We can eat less meat. We can travel less by car. We can convert any gas appliances to electric. We should be demanding that all new construction is electric only. We can plant more trees, but I have to say that all of these efforts truly are not the things that are going to significantly move the needle. We need action on a national and global level to really just eliminate the use of fossil fuels entirely. And until we make that shift, I think we are going to be just pushing a big rock up a hill. And where I have the most faith, frankly, is in Generation Z. I see really middle schoolers through young adults who are absolutely focused on climate change and climate safety, and with good reason, because they're the ones who are going to be around the longest here. And they give me hope that they are going to keep this issue front and center and demand that all of us change our ways.
So sorry, we've got to run. Thank you very much, Supervisor Susan Ellenberg. And I hope you'll hang around and watch the show the next time we have a guest as well. Thanks again.
Thanks again, Terry. My pleasure. Bye-bye.